So what do we recommend, and what do we convert it to, is the distal femur IO. The distal femur is a beautiful bone because it's really large, and where you're going to be going, which is 2 centimeters above that tuberosity on the medial aspect of the femur, we'll show you that here in an image, you could see that that bone is fully calcified, it's big, and once you get into it, it's solid. You almost don't even have to anchor it down. And so the femoral IO gives you faster rates, easier flow, and it's really an easy place to put that IO. The one caveat here is very important, is that femoral tissue, you're going through some skin and some muscle and so forth, so that needle, that plastic of the needle, as it's spinning, if the child is conscious, it's going to hurt. So we would not advise a femoral IO in a conscious child. We would advise you to go to the proximal tibia in a conscious child. For example, if the child was septic and needed fluids and you couldn't get an IV, or hypoglycemic and needed dextrose and you couldn't get an IV. The distal femoral IO should be for the unconscious child, cardiac arrest, and it's very successful, and we would advise for you to use that. So thank you very much. This has been another episode of the Hantevi Minute with Dr. Peter Hantevi.
Here you can see them coming with 2 fingers to palpate just over the patella to determine the depth of tissue. Don't look at the 2 fingers as a marking of distance. It's 1 centimeter above the patella and 1 centimeter medial would be your location for insertion. After you clean the insertion site, then you're going to take your needle, and as you can see, you want to see the depth of insertion. So if you look at the blue needle has 25 millimeters or 2.5 centimeters. And as you can see there, that needle will be too short. You want to make sure that the needle, there's the black line, which is the 5 millimeter line, is sticking out of the tissue. That's how you know the depth. So there it is. The puncture through the skin, touch the bone, make sure that there's a 5 millimeter mark that's still exposed outside of the skin, and then you know the depth, the needle is the correct size. I'll talk about needle size later, but let's just get through this video. Now you stabilize with your hand, remove the drill, counterclockwise, pull out the needle, put that into a sharps container. Now you're going to put the dressing over that. Come in, clear the line with saline. It's ready now to attach. Now, when you aspirate back at this point, after you secure the line, you're going to aspirate back to see blood. If you see blood, that's great. If you don't see blood, that does not mean that you're not in the proper location. Flush with 3 to 5 milliliters of saline, and then you can also recheck then to see if you have blood return. Secure the line so you don't pull this out. Now, to remove it, you're going to go counterclockwise, pull off your line and syringe. Then you attach the syringe to that. You're going to rotate it clockwise and directly pull straight out. You're not going to wedge it back and forth. You just pull one clockwise turn and straight out. Needle size. So the manufacturer, you have the pink, blue, and yellow needles. So the size of the pink needle is up to 15 millimeters or 1.5 centimeters, and as you can see, up to 39 kilograms. The blue is 25 millimeters up to 40 kilograms, and the yellow is 45 millimeters up to over 40 kilograms. So the key thing is, it's not so much, these are guidelines. When you, as we said in the video, when you palpate and you see how much tissue is there, you can kind of estimate what size needle you're going to need. It's not saying that if they're 20 kilos, they have to have a pink IO. You have to look at it and use your judgment. So the key thing is, as we said before, the 5 millimeter line. That line should be above the skin. And if it's not, then you have the wrong size needle. So you may have to, in a pediatric patient, you may actually have to use the yellow IO needle depending on where you're placing the needle. The key thing is put the IO in, palpate the bone, and then look at your markers to make sure you have at least 1 5 millimeter marker above the skin.